Hello friends, this is Dr. Kuldeep. I am working as a pulmonologist in CK Birla Hospital, Gurugram. So I shall be speaking on chronic obstructive pulmonary disease, that is COPD, which is a very common problem nowadays. Patients are being diagnosed as a case of chronic obstructive pulmonary disease, which is a well-known entity throughout the world, because it is very much important to aware ourselves about COPD. If we know that we are having this kind of prevailing entity into our respiratory system, we will be better aware of this problem, and we can easily treat that. Patients usually coming with COPD symptoms, primarily they would be having, some patients would be having coughing, some patients are coming with primarily only breathlessness. So we are not able to climb stairs, we have to take a slow pace. This is the usual complaints who are coming with complaints of breathlessness in initial cases of COPD. And some patients are of different varieties. They are complaining of coughing. Coughing would be purulent. Cough would be of mucoid type. All the day coughing is there. We are taking antibiotics or symptomatic steam kind of treatments, local measures, but that cough is not getting benefit, any kind of benefit. So COPD is a problem that is respiratory related problem, because COPD involves two kind of problems, that is chronic bronchitis and emphysema. Chronic bronchitis means our airways lining get inflamed and obstructed over a period of time, usually 1 year. So chronic bronchitis definition involves cough more than 3 months to 1 year, that is present all the time. Second is emphysema. Emphysema means irreversible destruction of our respiratory airways. That is a medical term. So emphysema means our airways get enlarged. Chronic bronchitis, our airways get shrunken. So this chronic bronchitis and emphysema, diagnosis of COPD is very much clear with simple spirometry test. Spirometry test is a pulmonary function test that is done in hospital settings only. So pulmonary function test parameters would be read up by a chest physician, and we will be able to know within few minutes that you are having COPD or not. Because COPD, when we are able to diagnose it very early stages, we are going to get control of it, and we can have various treatment modalities for it. Because the problem is, if it is an advanced kind of COPD, then treatment has to be taken for many years. So COPD, unlike of asthma, is a chronic progressive problem. If a person develops COPD, it is a progressive kind of scenario. So we will be having symptoms like starting from mild to moderate, and then if we're not getting treated mild to moderate, then it can convert to severe kind of things. So 2 and 3 things are very much important for preventing prevention and treatment of this COPD. First and foremost is related to COPD is smoking. Smoking is very much injurious for our respiratory system, because there is direct proportion of smoking and chronic obstructive pulmonary disease. If we are ongoing smoker, we have to reduce our smoking, and thereafter we have to get enrolled in quitting protocol as well, because smoking is very much dangerous for our lungs, as we all know. Second is environment pollution. Environment pollution can be indoor, it can be outdoor. Indoor, if we are staying indoors, so house dust mite and any kind of allergies that can cause chronic problems that might lead to COPD, like that of asthma. So outdoor pollution, industrial dust, automobile industries and traffic, this pollution exposure can cause COPDs. Treatment of COPD is as simple as that. Previously, in last years, it has been started with steroids or that kind of stuff, but treatment of COPD always been started with respiratory inhalers. Inhalers will be of 2 types, that will be of pasteurized metered dose inhalers. So inhalers will be given as much as you are having symptoms for that time. If your symptoms are getting benefit, your cough is getting weaned off, so your inhalers will be weaned off slowly over period of time in subsequent visit. So COPD is a problem that can be prevented and treated very easily if we are well aware of the problem, well educated about this problem, and so that we can easily catch hold of it and we can easily treat it. Thank you for this patient's hearing, and thank you so much.